Hey, it's Naturopathic Medicine Week, and I'm Dr. Brianna Botsford, the founder of Flow Functional Healthcare in Edmonton and a naturopathic doctor myself. This week is a time to celebrate naturopathic doctors, whole person care, and taking charge of your health from the inside out. This week, we're sitting down with our patients and colleagues who want to share their unique experience working with naturopathic doctors. Whether you're curious about natural medicine or ready to feel inspired to take action for your health, you're in the right place. Okay, so it's Dr. Brianna Botsford, and I am back with our series of videos for Naturopathic Medicine Week. And this time I am here with Maya. Maya, thank you so much for doing this interview. And can you tell us a little bit about yourself?
Hello, thank you so much for having me. My name's Maya Henriquez, and I guess sort of my background is I was a registered nurse in my undergraduate studies by training. And so I worked as an RN or still do. So for about 15 plus years in labor and delivery, I did a master's in public health and focus in global and population health and mostly working in women's health areas. From there, I did that in Vancouver. I moved back to Edmonton where I met Dr. Colleen Norris, and I work as her research project coordinator. And so now I've transitioned to working for the University of Alberta, and we work in doing just a whole series of different women's health studies related to hormones, cardiovascular health, menopause, perimenopause. So we're having a lot of fun and just trying to kind of push women's health research forward.
And you are pushing women's health research forward. I know that for a fact. And that's so cool. I didn't know you did your training and a lot of your work in Vancouver. Maybe I forgot that at some point. But as a healthcare provider and as a researcher, what influenced your decision when you were initially considering working with a naturopathic doctor?
It's funny. I feel like I don't know what all those words are, kismet or destiny or whatever you want to use. Our
Yeah.
paths crossed so wonderfully organically because I was getting more involved with the Alberta Women's Health Foundation and the university and doing all this work. And you work so intricately with them as well. And so when we first started doing research in menopause, I we kind of said, where do we even recruit our population from? Like, it's
Hmm.
every woman, yet there's no one place we can go to target women in perimenopause. And so I said, I'm going to do, a quick scan of Edmonton and see what services are out there. And I saw Flow Clinic, and it just had so many women talking so beautifully about it that I told Colleen, I'm going to reach out to a few and see if they would help us recruit. And I came to your clinic, and
Hmm.
you guys were just so wonderful about wanting to push our research forward and doing whatever you could to support us. So, and then I realized that, our paths crossed in so many other areas, which was
Hmm.
nice.
Yeah. Yeah, I mean, we are so passionate about generating that data, right? Because we do have so many patients that either are experiencing conditions that may not have adequate evidence to inform like their treatment pathways or even just to give them the support that they need or getting to a diagnosis in a faster, more timely fashion. So it's like we were like 100% whatever we can do to support this research and to help our patients even participate in these research projects. And that's why, like, when you come to the clinic, you'll see various posters, asking for people to join these research studies or even asking to join the registry for women's health research in Alberta, which I think you're still recruiting for, right?
Definitely. Yeah.
Okay, and we'll make sure that we put that link in the notes for this video, so if anybody is interested in participating in research, they can join that registry, and then they can be contacted if there are studies that they may be eligible to participate in, because more participants are usually needed.
Yes, always.
So, is
Definitely.
there anything that has surprised you about working with naturopathic medicine or naturopathic doctors?
You know, I I will say I think it was my own personal experience that surprised me more. So as much as I had gone to all of these clinics to ask for their help, I also then became a patient of yourself and Flow. And I think you probably get a lot of patients like me who, we've likely, been to every specialist and asked for every referral and tried everything. And we're kind of at our wit's end and we
Mm.
feel like, what else am I supposed to do now? And then you think, okay, well, I'm going to go to naturopathy because it's not something I would have considered.
Mhm.
And then I went and I thought, wow, this is not what I imagined at all, and it was such an education for me to realize what your work was. And I'm sure, again, you get a lot of me who come into the office, and I just kind of was like, I'm ready to throw however much money on whatever test, just get me answers. And you're
Mhm.
kind of said, okay, let's take a step back. And you really spoke to me because, I mean, I think our first appointment was 2 hours long, but you got to know me, and I think what we love about yourself and Flow and what you've really opened our eyes to about naturopathy is that you guys are also very evidence-based,
Mm.
and you knew my language. So when you're like, we're gonna start with option A, B, and C. We're not just gonna buy every test under the sun, and we're not
Mhm.
gonna spend all of your money. We're gonna see what's proven and what's evidence-based, and we're gonna work our way through it to figure it out. And that, for me, made me just feel so strongly, not just about being a patient, but also about our, like, research relationship
Mhm.
and everything that you help patients with.
It's that idea of like, what is the outcome of this test or investigation going to change about your treatment plan, right? So we're not just like, let's do $5,000 worth of testing or 500 to whatever, like number worth of testing and like hope we find something. It's like, how is the data that we're going to get influence the outcome and like your treatment plan and your trajectory? Because we might be choosing to look at different like pharmaceuticals. We might be choosing to look at different naturopathic interventions, whether it's like nutrition, lifestyle based, or if it is like a herb or a supplement or something like that. But like our data is driving our decision making. And sometimes the data isn't another test too, right? It's that history taking and like what's gone on symptomatically. And that's also, I think, where the research comes in is it's like there's a lot of conditions where we don't have a good test. And so we have to make like a clinical diagnosis based on our history and our impression of the patient. And then we're also using our treatment plan as the test sometimes. It's kind of like if option A works, then that confirms the diagnosis, right?
Yeah.
But if we need to go to option B, then that maybe refutes that or makes us think maybe that wasn't the right diagnosis in the first place. So it's kind of that system of working through it.
Absolutely. I mean, it just completely mirrors, how we would do it in kind of that Western medicine practice. And all of that is so greatly intertwined.
Mhm.
I would argue more so that somehow your breadth of knowledge of all that evidence is unimaginable to me.
I try really hard. I do a lot of continuing education. I read a lot of papers, as I'm sure you do too.
Very evident.
It's one of those things where you're just like, okay, another PubMed alert. How can I internalize this as quickly as I can, right?
Yeah, but I respect it a lot because not to go on this tangent, sorry, but
Yeah,
I,
it's
I
okay.
often feel that maybe we don't push ourselves as much, in the primary care system or the acute care system because maybe we're just given that kind of credibility and that knowledge. And
Mm,
so I think often you're combating that in naturopathy. And so
yep.
unfortunately,
Yeah.
I hate that, but maybe that has been so beneficial in that you guys really are forced to maintain that and push that and gain all of that knowledge and understanding.
Yeah, and I think it's also like because we have the luxury of time with our patients, but then like that also I think then leads to less clinician burnout and then we're able to stay like excited and passionate about like the latest guideline for PCOS or whatever, right? Like it's like, oh, like I'm going to read that and see like how are we actually implementing this from a naturopathic standpoint, but also is my patient actually receiving the standard of care or can I help them advocate for that, being that I'm not burnt out and I have the luxury of time to consume this knowledge. Yeah, I mean, I love what I do. And I love what you brought up about kind of coming at it from like that underdog mentality. It's like, no, but it's so true. Like, I do think that that's a lot of what's behind that desire to also stay up to date to make sure that we are in alignment with our medical colleagues and we're not, just out here in left field doing something that's totally not evidence based or also like not indicated or safe. for our patients, right? Yeah.
I mean, it is a framework that, we could learn a lot from.
Well, that's why we love to work together. It's
Yeah,
awesome.
it is.
Is there anything you wish people understood more about naturopathic medicine, or anything that you would say to someone who's like unsure about maybe consulting with an ND or seeking naturopathic care?
Yeah, I think that mostly it goes hand in hand.
Hmm.
I think often, like you said, you guys, of course, there's other methods in terms of naturopathy, of approaching different diagnoses and treatment plans. But at the end of the day, it really is just looking at the whole person and trying to understand how it all ties together. And we don't often get the opportunity to look at that when it comes to kind of the primary care system. So it is that whole systems approach.
Hmm.
And I just think that they really do work beautifully together. It isn't that you have to have one or the other. It is
Right.
that, you can approach both. And like you said, you're always going to work with, if I were to come as a patient and say, "Oh, my nurse practitioner or my doctor, wants to start this or do this because of A, B, and C," you would just say, "Okay, great. Let's work with that and look at it in this frame, including that treatment plan and how we can work with it and around it." So I think just making sure that you take a chance on it, because it is so important to achieving your health goals. It really is.
Yeah, it's like you don't have to choose one or the other. You can do both. And it is possible for these naturopathic interventions, lifestyle, nutrition, exercise, like herbs, supplements, vitamins, all of these things to like coexist safely and effectively with that conventional or primary care plan. And having that consultant, like that ND, to help facilitate the bridging of those two so that we're not getting drug herb interactions or supplement drug interactions and things like that. So that way we know both plans are going to work to their like full extent, and ultimately it just becomes part of that whole care plan.
Yeah, and you kinda nail on the head. There is this knowledge gap that we're missing in primary care, and a lot of that, it just brings up this memory of my father when he was ill with cancer, and it was so important for him and my mom, from their perspective, to maintain those supplements,
Hmm.
those remedies, all those other things that we label as naturopathic but are
Yeah.
are built into us.
Right.
And so when we were doing treatment, it was we don't know the interactions. There's
Hmm.
not safety there. And it's like, oh, but that knowledge does exist. And
Hmm.
it doesn't mean that we're gonna go to a naturopath and they're gonna say, make sure you maintain all of this medication
Right.
regardless. It is actually, we do know that A, B, and C you should stop. These three you can continue to take because there is evidence that shows that it doesn't interact and it is safe. It's not a second opinion. It's just full care.
Right. Well, and we know patients are using supplements, right? Like we get that in the research all the time. Like patients are using supplements. They're buying. I always call them like bro science, or I guess there's like a lot of women's health marketing and of supplements and things like that that goes on right now, especially too. And so they're like buying these TikTok supplements and they're taking them. So, like, why not have somebody audit that and ensure that it is safe with whatever pharmaceuticals, or even like not if it's a drug, supplement, drug herb interaction. It could be just something that we'd have data over long periods of time. It can cause an elevation in like liver enzymes or like
Yep.
toxicity, like, even something as innocuous as vitamin D. People think like, oh, I should just take more and more and more of it. But like it's fat soluble and it can accumulate in the tissue. And you can have, I've caught it twice ever in my career, but like it can happen, right? Like
Yeah.
where there is that like,
Yeah,
toxicity. And so it is just like, we know patients are going to do it. So why not have somebody facilitate that safely?
absolutely.
Yeah.
And somebody who has all of that knowledge, which is beautiful that we have access to. So
Mhm.
absolutely, people should utilize it more.
Awesome. Well, Maya, thank you so much for doing this with me. I am
Absolutely.
so grateful for the work that you do and that all of the projects that you help to coordinate. And it's just been such an honor to be part of that process as well. And we'll make sure that we put in the little show notes here the link to the Women's Health Registry for research, and any other projects that you want to let me know about. We'll make sure we put in there so that we can continue to recruit participants for this really important research. But yeah, thank you so much for doing this with me.
Thank
I so
you.
appreciate you.
We're so grateful to have you involved in our projects. And yeah, just to be able to work with you is so wonderful.
Awesome. Thanks. Thank you so much for watching, and a huge thank you to our guest for sharing their story today. If this conversation sparked something in you, don't wait. We're here to help. You can schedule a complimentary 15-minute visit with one of our naturopathic doctors at Flow Functional Healthcare in Edmonton today, or give us a follow, like, or share this video to help us help more people live healthier, more energized lives.